Awesome, thank you. We're sometimes terrible at forgetting, so thank you for that. So as I mentioned, my name's Melissa, and Health Consumers Queensland is Queensland's peak health consumer organisation. We work to help people who use the system and their carers to partner with the health system to make services and policy and care more focused on our needs. During COVID, as you can imagine, we've been quite busy, really trying to focus everything that we do and all of the partnerships that we try to support to really support the pandemic response in Queensland. We put together a special community of interest of people who wanted particularly to have a say in the pandemic response. And as I said, we've held over 25 consumer conversations during the pandemic on a whole range of topics, from testing to care of people who are COVID positive. And some of you I know were regular attendees of those, and thank you so much for contributing your voice and your ideas on how we could continually have our pandemic response improved. So now we also received additional funding for some important additional projects, including the creation of a youth network to amplify young people's voices. We've got a project happening to evaluate the role of the consumer voice in the pandemic response in Queensland. And we also have some additional funding for a First Nations consumer project. And I'd like to hand over to Linda Maybanks to share with you about that project. Thanks, Linda.
Thanks, Melissa. Good evening, everybody. I'd also like to acknowledge our elders here on the line and pay respects to our elders past, present and emerging. My name is Linda Maybanks and I'm a proud Yagul woman. I'm from down here in Ipswich and Lockyer Valley regions. I used to work in the division with Haylene in the communications team working on COVID. Then I went back to my substantive at Westmoreton Hospital Health Service, and now I've been given this awesome opportunity to work with Health Consumers Queensland. So I pretty much just want to tell you guys that tonight is the first of many opportunities for our mob to be involved in this project, which is called Amplifying Aboriginal and Torres Strait Islander Voices, and it's been established to enable First Nations Queenslanders to provide direct feedback about COVID vaccinations, rollout in the community, and the communications about this, the policy development as well. Consumers will also have a say on broader policy design to inform the development of best practice model for engaging First Nations health consumers on a statewide level. So we're hoping that, as a deliverable of this project, that we're going to be developing, some mechanisms to help health services engage better with community and making sure that our mob are heard throughout this pandemic, but also into the future as well, that we've got those support mechanisms that we need to ensure that, our community voices are being heard. So as part of this project, we're also asking health staff, I know we've got a lot of health staff online tonight, we're also asking for your help as well. We want to know what engagement is happening across the state, what's working well, and how we can try and capture that and share it across sectors. I think we should be sharing some links in the chats on how we can get involved in that. So yeah, thank you. And yeah, I will be working on this project up until June this year, hoping to, hoping that this is just the first of many types of engagement that I'll be having with all of you. So yeah, thanks. Back to you, Melissa.
Fantastic. Thanks, Linda. And we're so thrilled to have you on board working on this project. It's just a delight. So I think I have one more bit of housekeeping, which just is to recap on our forum safety policy. So just to make a note that all of our events operate on principles of respect and courtesy. We respect the right of consumers and carers to make informed decisions about your own healthcare. We may hear a diversity of views this evening, some of which you may not share. This is a safe space, so we ask everybody to be respectful of each other, of Dr. Young and Ms. Grogan during tonight's forum and in the chat thread. Please do not make comments that are discriminatory, racist, abusive, obscene, inflammatory, untrue, inaccurate, or put others at risk of physical, emotional, or mental harm. If such comments continue to be made or are made, we will remove participants from the online forum. However, we expect this not to eventuate, as all of our events do operate on principles of respect and courtesy. So I'd now like to introduce Dr. Young. We're going to start by hearing from Dr. Young and then Haylene, and then open up for questions. As I said, please feel free to put your questions in the chat during Dr. Young's presentation, and perhaps tell us who you are, if you're a consumer or a staff member, and then pop your question in. So Dr. Young, I'll hand over to you, and I'll ask you to begin by explaining your role, and I guess how that's changed in the last 12 months. Thanks, Dr. Young.
Thank you very much, Melissa. First, I would also like to acknowledge the traditional owners of the land upon which I'm seated here this evening, the Turrbal and Yagara people, and pay my respects to elders past, present and emerging, and just absolutely commend the First Nations communities and people across the state for how they've managed this pandemic. So we have not had a single case of COVID-19 in one of our discrete First Nations communities, which was always one of my personal nightmares, and I'm sure a lot of your nightmares, because we know that were it to get into one of those communities, it would have spread very rapidly. So we are going to have the opportunity to roll out the vaccine before the virus rolls itself out, which is always the dream of anyone involved in public health. So congratulations to all of you in the leadership and how you have worked in your own communities as leaders, as consumers, as representatives, and you've worked so effectively together. It's been absolutely astounding. The second thing I'd like to acknowledge is Haylene Grogan. I think it was just perfect. I don't know how we managed it. Just as we're about to have one of, the worst pandemic in 100 years, along comes someone to lead the most vulnerable people in Queensland, and so effectively. So I'm positive a lot of their success has been due to Haylene. So congratulations to you and how you've led your team. So absolutely brilliant. Now, I do want to thank all of you for being involved this evening as representatives from your communities, as leaders, as people in your communities, with all the diverse backgrounds and experiences that you have. It's just fantastic that you're able to come and be involved tonight and to be able to come with your queries from yourselves and your communities. It's so important that we have that engagement. And thank you to Melissa and Health Consumers Queensland for bringing the group together and enabling this to occur. It's critical. And it was great to hear from you, Linda. I can still see your face up there to hear the work you're doing. It's very, very important. I can't underestimate or overemphasize how important it is. So all of what you've been doing for the last year has just been critical. I've actually quite enjoyed those very, they were frequent, they've died off a bit. Maybe we have to reinvigorate them, but that chance that I had on a regular basis to talk to all of the mayors from across the state, so many of whom are First Nations mayors, and to have that involvement every step along the way has just been critical for us throughout Queensland. And I do believe with that continued cooperation and involvement that we've seen from the start of the pandemic, that we'll be able to manage the next phase of this pandemic, which is making sure that every single Queenslander who's able to get vaccinated does get vaccinated. That's what's going to get us out of this and able to return to a more normal life, which I'm sure all of you are looking forward to. I certainly am. And we're very much committed, I'm committed to forums such as this one tonight and any other forums that are useful, and also to develop materials that are relevant for every person in Queensland and accessible for every person, so that people can get answers to their questions. That's critical. So I want people to make informed choices, but informed choices after they've got all the information they need to make that choice. I don't want people having to guess or to try and take previous experiences. I want them to get the information they need so they can be certain they're making the best decision for themselves and their families and their communities. So we commenced our rollout of this vaccine only last Monday. It seems like months ago already. What we've achieved in 1 week is just fantastic. So we started at the Gold Coast, and just so you know why I want to start at the Gold Coast, they had the first cases of COVID-19 in Queensland, so I thought it was right for them to have the first vaccines there. So they got going last Monday and did a brilliant job. Now, this first phase of the vaccine, it's called phase 1A, which is all just numbers, but this first phase, the aim behind it is to vaccinate around 125,000 people in Queensland, and they're two different groups. The first group are those I'm most concerned about, who, if they were to get COVID-19, they would then spread it through the community. These are the groups of people who are dealing with cases coming through our border every single day. Today we had 4 more cases, for instance, and are then managing them in hotel quarantine till they're diagnosed or in our hospitals and health services. So there's 37,000 of them, and we've well and truly started vaccinating them. Then the Commonwealth Government has organised to vaccinate the most vulnerable people across our state. Some of them will be your people who are in aged care or disability care facilities or the staff managing them. Others are other people living in aged care and disability care and the staff managing them. So the Commonwealth has started that process. So last week we're now up to 3,010 people have been vaccinated, and that 37,000 that Queensland Health is vaccinating. We're rapidly ramping up their process. And as I said at the very start of my introduction, this is just astounding that we're rolling out a vaccine before the virus has even got going. So that is just brilliant. So we've had around 1,300 cases of COVID-19 in Queensland. Across the world, we're up to 114 million cases. So it is just fantastic. We can vaccinate people before they've even been exposed to the virus. Now, the important thing here is that the vaccines are safe. There is absolutely no doubt in my mind that that's the case here in Australia. We've got one of the most rigorous approval processes in the world. The TGA is the most nitpicky regulatory authority there is possible, which is what we want. We want them to go through it in fine detail and make sure that everything's checked. We are not in a crisis situation in Australia. We don't have any virus out in our community. It's all in our hotel quarantine now. So we can be slow and careful and make sure we've got it absolutely right. We don't have to vaccinate people today to save lives. That's what they're having to do in the UK, and they have done it so well. Boy, they might have managed the spread of the virus a bit. I won't go there, but they have managed the spread of the vaccine beautifully, and they are saving lives every single day. They've seen that. We don't have to do that because we don't have virus in our community, so we can go through a rigorous process and make sure the vaccines are safe. So the TGA has done that now for 2 vaccines, the Pfizer vaccine and the AstraZeneca vaccine, and both of them they have deemed absolutely safe to roll out in Australia. There are no concerns at all. Remember, they're looking at them in terms of a country that doesn't have virus. So every single vaccine, every single delivery has to be safe. So they have just a fantastic track record in in approving new drugs and new vaccines, and they will only ever approve a new drug or a new vaccine if it meets their very strict assessment criteria, which is focused on safety, effectiveness, and quality. Then a few other things I want to sort. So I'm going through a whole lot of questions that people have been asking me non-stop. So hopefully it'll answer your questions, but if I don't, just ask as we go through this. Put it in the chat and we'll make sure we sort them out. There's already 54 questions in the chat, which is just brilliant. So the next one, how do you know that someone's not spamming you? It's if they ask for money when it's related to the vaccine. This vaccine is free, so there is no cost at all to this vaccine, with one tiny little caveat. You might get charged for parking depending where you go. So we all know about parking and hospitals and all the rest of it. That's the only charge, but that will only be when you turn up. So if anyone gets any request for money for these vaccines, it is free for everyone. If you're on the soil of Queensland or Australia, you'll get a free vaccine. Doesn't matter whether you've got residency or a passport or a Medicare card, or if you're on the soil. So if you're a refugee, if you're a diplomat, if you're anyone, you'll get vaccine for free. We want everyone to get vaccinated who can be vaccinated, because that's really important to protect the whole community. Now, it's not mandatory. Absolutely isn't. Our Prime Minister has stood up many, many times and said this is not going to be mandatory. But I am desperately hoping that by getting the information out there, everyone will want it. That's my absolute aim, so that as many people get as possible, because it is really, really important that everyone who possibly can gets vaccinated. Now, there may be issues with employers and so forth, and there'll be discussions about that. But at this point in time, it is absolutely up to each individual. So we're going to get the vaccine out across the entire state. Initially, there are 6 hubs that the Pfizer vaccine, which is a more difficult vaccine to manage, are being distributed through for the public sector. So that is up in the north, Cairns, then Townsville, Sunshine Coast, Royal Brisbane, the STARS facility at Royal Brisbane and Women's Hospital, PA Hospital, and Gold Coast University Hospital. But we're very rapidly, because we're shortly getting a shipment of AstraZeneca vaccine into Queensland, will increase the numbers of places, and we'll be getting it out to everywhere. If you can get vaccinated for flu in your normal community, you can get vaccinated for AstraZeneca once we've rolled it out, because it is as easy to distribute as the flu vaccine is. So that might help people understand where it will be able to get to. So just one quick reminder before I get on to some very specific information, that nothing's going to change in Queensland tomorrow or next week or the week after. It will take a little while before we get enough people vaccinated that we can go and remove restrictions. So while we're rolling out the vaccine, it's really, really important that everyone continue all of those COVID-safe practices that have become second nature that people are doing so well. So maintaining physical distancing where you're able to, washing your hands, good hygiene, and most important of all, stay home if you're sick and get tested. That one's just critical, and that one we really need to continue as we go forward. Now, in terms of some specifics, so how effective these vaccines are, there's over 200 different vaccines in development around the world. At the moment, we've, as you've heard, rolled out the Pfizer and the AstraZeneca vaccines, and they are both extremely effective against COVID-19. So effective that I can't differentiate between the two, and I'm certainly going to take the first one that someone is prepared to offer me, which I hope is fairly soon. But I'm not in 1A. I'm not one of those people I described at the beginning, so I'm not in one of the first groups. but I hope to get vaccinated fairly soon, and I'll have either of the 2 vaccines. They're both absolutely fantastic. So no one should wait for a particular vaccine. It's more important to get vaccinated as soon as you can rather than wait, because we know that there are new variants that are occurring throughout the world as the virus mutates. And so we'll know there's every chance we'll end up having a third rollout of vaccine. So the first 2 doses of Pfizer and AstraZeneca, and then a third dose that'll be a modified vaccine that will account for the new variants. Now, your first 2 doses have to be the same, either AstraZeneca or Pfizer, but the third one won't. It can be whatever new vaccine is developed that is effective against the variants. Now, being vaccinated is just critical. The reason being that once you've been vaccinated, what it does for you, and I've seen that come up through the chat line a number of times, what it does is it means that you as an individual can respond faster to that viral infection and far better, so that you either won't have any symptoms, or if you develop disease, it'll be much less severe and very, very unlikely that you'll need to be hospitalised, and extremely unlikely that you'll die. So that is why you need to be vaccinated. So it won't necessarily stop you getting the infection, which is why everyone has got to be individually vaccinated. You can't rely on herd immunity, which is what we do for various other vaccines. If enough people get vaccinated, then we know that it's highly unlikely that that disease will spread in the community. That's not the case for this vaccine. You yourself, as an individual, have to be vaccinated to stop getting it and getting a severe illness and dying. So that's the difference here. We're hopeful that we'll get more data going forward and be able to work out what percentage of people then don't get infected at all, so it can't spread it. But at the moment, the best thing is just get vaccinated. Don't rely on other people being vaccinated. And if I could point out that for our First Nations communities, you're actually one of the best at getting vaccinated. Your kids get vaccinated, over 95% of them. So you're already way ahead in terms of understanding the importance of vaccination. Those communities that don't tend to get vaccinated are those that live in the hinterlands of our big cities, particularly the Sunshine Coast, the Gold Coast. So I am a bit worried about those communities because if they don't get very high rates of vaccination, we will see spread in those communities when this virus does eventually get into our communities, which it will. We can't keep our borders closed to the rest of the world forever. No one would think that. So that's why it's really important that you do get vaccinated as soon as you can, as soon as it's offered to you. Now, in terms of where, I've mentioned this briefly about where we're going to distribute the vaccine to. Initially, because there's only those 6 hubs, I am concerned that people might think that we're not going to get it out across the whole state. We will. It's just that we won't be getting the Pfizer vaccine across the whole state because of the problems with its distribution and its supply chain, because it has to be kept at below -70 degrees Celsius. But for the AstraZeneca vaccine, I have no concerns about that getting out to every little tiny weeny community across the state. That's what we do every year with the flu vaccine. That's what we do with our school-based vaccines. That's what we do with all of our other programs. So we'll get the vaccine out there everywhere. Now, it is the Commonwealth Government that is responsible for the rollout of this vaccine throughout the country. They have done an absolutely first-class job at producing and at contracting with the major manufacturing companies for 2 fantastic vaccines. They were the ones that identified and contracted for those vaccines, so they've done a really good job. They have been responsible for developing Australia's COVID-19 vaccination policy. It was developed in collaboration with states and territories, of course, but ultimately they were the ones that developed that and put it out there. And that is what has set the priority groups and set the order for the vaccine rollout across our country. And we, of course, are following that vaccination policy here in Queensland, as are all states and territories. Now, we had to do a staged rollout. We couldn't just do what we do with flu each year, which was just say, time to come and get vaccinated, because the amount of vaccine available has been very, very small, and it's just starting to get ramped up, but the amounts are still very small. So we can't just say to everyone, please come and get vaccinated. We've got to do it in priority groups. And that's a reason for it. And also you would have heard that GPs had to put in an expression of interest. And again, that was purely because we didn't want to have, you know, thousands and thousands of GPs and Aboriginal controlled medical health centres and pharmacies, etc., all getting a tiny amount of vaccine. That wouldn't have helped anyone, because then you would have had more vaccine in fridges across the country than you would have had in people's arms, which is where we wanted to be. But as soon as we've got large amounts of vaccine available, it will be rolled out to every GP who normally has vaccine and has a fridge to store it in, a fridge for the AstraZeneca vaccine, which is 2 to 8 degrees Celsius, which is a normal fridge for vaccines, to every pharmacy that wants to be involved, and of course to all the Aboriginal medical health services. So it'll be out there to everyone. Now, I do want to very briefly mention, because I'm sure you would have heard it because it happened in Queensland, we did have that incident at an aged care facility in Castledine, where the Commonwealth program had a bit of a hiccup, where a vaccine was given to 2 of the elderly residents, and unfortunately 4 times the dose was given. I'm very, very pleased to announce that both of those people are perfectly well and fine, and they've had no adverse consequence from receiving 4 times the dose. But that's not to say that we want that to happen again. So the Commonwealth is working that through with the provider, Healthcare Australia, HCA, that was responsible for that staff member who gave the incorrect dose and hadn't done the required training. Within Queensland Health, we have got assurance processes in place so that won't happen, and the Commonwealth is now introducing assurance processes so it won't happen in any of the aged care facilities. I think you should all be confident that that was a one-off, and that that will be sorted so it won't happen, but thank goodness those 2 individuals are absolutely fine. So that was an enormous relief. Now, once phase 1A is completed, we'll move on to phase 1B. So I'm just going to take you all through those different phases. And you can go onto our website or the Commonwealth website to see what those phases are, and that the whole country is going to go through those phases. So phase 1A, the first 125,000 people in Queensland, started last Monday, and will take around 4 to 6 weeks. So it is the quarantine and border workers, frontline healthcare workers who look after confirmed cases, aged care and disability residents, and their staff. So that's rolling out as we speak. Then in the next 4 weeks or so, we'll move to phase 1B, which in Queensland is 1.049 million people. So that's older adults aged 70 years and over, and First Nations people over the age of 55. And you can imagine why it's those 2 groups. It's because they're more at risk of having severe COVID-19 if they contract it. So they're in phase 1B, as are all remaining healthcare workers in public and private, because although they're not actively looking after confirmed cases, they could in the future if we were to have an outbreak. So they're next. Then also part of phase 1B are younger adults, and this includes, of course, younger First Nations people who have any underlying severe health conditions, including people who have a disability. And as well in that phase 1B are critical and high risk workers, including police, fire, emergency services, defence. And then one last group that might be a bit strange to us in Queensland, but because of what's happened in other states, a decision was made to include them at this stage. And that's people in meat processing plants. And that's because in Victoria, when they had their outbreaks, it just spread so rapidly through those workers. So they're included in phase 1B. Then we go to phase 2A, which we estimate will probably be around May, June. That's 1.255 million Queenslanders or people in Queensland. So that's adults 50 years of age or older. That's all adult First Nations people, so 18 years of age or older. And it's the remaining critical and high risk workers who weren't picked up in phase 1B. Then after that, we go to the remaining adults in Queensland, so 18 years of age and over, and anyone, of course, who's been missed in earlier phases. So that's 1.496 million Queenslanders. So as you can see, we've done the modelling to work out who all these different people are. Then we think that'll take us till the end of October to get through. Once we get there, in the meantime, all of the drug companies have started doing clinical trials on children to see whether it is safe to administer these vaccines to children. Pfizer has already done trials for 16 years to 18 years. AstraZeneca hasn't. AstraZeneca's only done 18 years plus. Now, depending what those trials show, and depending where we are with children, we will then look at whether or not the remaining 1.17 million Queenslanders who are kids under the age of 18 will get vaccinated or not. So that will be a decision that is taken at a national level and will follow advice from the TGA, of course, to make sure that this is safe for children. And then we'll also look at whether that is something that we want for children, because it is very different to flu. We vaccinate flu kids under the age of 5 for flu because their mortality is as high as the oldest members of our community. They do really badly if they get flu. Whereas we don't recommend kids 5 through to older kids get vaccinated because they have very low risks from getting severe disease. And the risks for COVID are even lower than that. We know that healthy kids just do not die from COVID-19 and very rarely need to be even hospitalised. So that will come into the review as to whether or not we go ahead once we've vaccinated all adults to start vaccinating children. So there needs to be more work done. But we're starting with highest risk, which is our adults. So it is important that as we roll out these vaccines, that we get the information out so that Queenslanders understand when they might be vaccinated, which priority group they're in, and all of the other general information about the safety and efficacy of vaccines and what the consent process is. And we're working very closely with GPs, with pharmacies, with the Aboriginal community health services to make sure that once we've got more vaccine and it's able to be distributed through to all of our normal vaccine providers across the state, that they know about it. Because essentially, I think it is really important that people get vaccinated in familiar settings where they're used to going for their vaccine, where they can talk to their normal vaccine providers. That's really important. We're also looking that if people are unable to leave their home to get vaccinated. So our elderly, most disadvantaged cohorts, for instance, we're looking at whether we'll be able to vaccinate them in their home. So some work's happening to do that at the moment. So as we move through all of those phases that I went through, we are hoping that every single adult Queenslander is able to be offered a vaccine. And I do hope that every single Queenslander offered a vaccine takes up that offer, because that is what will control spread of the virus and limit the severity of the disease in our communities. I just wanted then specifically to talk about Aboriginal and Torres Strait Islander community-controlled health services. So you'll be getting the vaccine because you're Commonwealth entities from the Commonwealth, and that I understand from the Commonwealth, all of you, unless there is this very specific reason that you're unable to roll out vaccine, for instance, you don't have fridges, you don't normally roll out the flu vaccine, etc., then I understand that you will be rolling out this vaccine to your own communities, which I just think is absolutely critical. That the vaccine is, as I've said several times, voluntary, and so every single person given it must provide consent. And there are resources that have been put together to assist the vaccine providers how to go about getting consent, so you don't need to reinvent the wheel. All of those forms, all of that information is already available. And of course, if an individual can't provide consent, that doesn't mean that they won't get the vaccine. It means that the person who normally makes those sorts of decisions for that individual when consent is required will be discussed with them, and they'll be able to provide consent on behalf of that individual, no different to other healthcare decisions that people make for people who can't provide consent. The Commonwealth has developed an enormous range of communication resources for people. So it's really important that you access those so that you can get information. It's been translated into multiple different languages, and there are resources particularly that have been developed for Aboriginal and Torres Strait Islander people. Queensland Health has also developed an Aboriginal and Torres Strait Islander information kit, which is available on our website as well. And it's
going to be up soon, Jeannette.
It's going to be up soon. There we are, if it isn't already. So I think Aaron might be checking whether it's already up or not, but it will be up very, very soon if it isn't already. And it's really important that you keep talking to people, keep asking questions, keep accessing information. So I just can't, I've got to stress again and leave before I go to Haylene that the vaccines that we will have access to in Australia today and going forward will be absolutely safe, absolutely effective, totally voluntary and totally free, except for parking in some of our facilities. And our goal is to vaccinate every single Queenslander that we're able to vaccinate at that particular stage of the rollout. The moment it's adults, may or may not later be children. Our goal is to vaccinate everyone, but to do it because people want to be vaccinated because they've had the information they need to be assured that it is the right thing to do. And I hope with all of the information that you'll be able to agree with me that it is the right thing to do. And I'll hand over to Haylene. Thank you.
Thanks,
now, do you want to come and sit here so you're closer to? Of course you can.
Thanks. Hello, everyone. Thanks. And I won't speak as long as Jeannette has because she's done a very, very good job. But I might try and summarise what we're doing. I do want to thank you, Melissa and Linda and Joe from the Health Consumers Queensland for giving us this opportunity, particularly me. I always get excited to join Jeannette in these opportunities. I enjoy hearing from people about what their concerns are, whether they're in the agencies or consumers. And thank you, Jeannette, for your kind words about our role that we've played in the COVID since we've been on this journey last year. Appreciate that recognition. And look, since the journey that we've had, and Jeannette and I have been on many occasions where we've jointly presented and talked, I've tried to approach COVID in three ways. And one is making sure we've got our comms right, we've got our engagement right, and we do the planning. And it's no different with the vaccination. We actually have to ensure that we get our comms right, that we get high engagement in this process, because that will help the communications, and we plan for the rollout of the vaccination. In terms of engagement, I will comment, like Jeannette did, on the leadership of the Aboriginal community in terms of keeping us safe to date, the leadership in government across agencies, both Queensland Government and Commonwealth, all coming together to ensure that we actually minimise the risk to First Nations people who have been brilliant to date. So that engagement is going to be critical going forward for the vaccination in the same way, and we will be doing high engagement opportunities again with the mayors and others that are important, not only the mayors, because we've got other First Nations communities beyond the discretes. We have been undertaking planning with the vaccination rollout, and we're very confident, Jeannette talked about it, we're very confident that our HHS's hospital and health services have been working closely with our Aboriginal, Torres Strait and community controlled health organisations. Jeannette mentioned that the Commonwealth have invited all the general GPs and all the community control organisations to enlist to be providers. In Queensland, it's really exciting to say that only 2 of the community control chose not to enlist. And those 2 have made it very clear they want to work with the HHS anyway to assist with the vaccination. So even though they haven't enlisted themselves, they're going to work with us in terms of the rollout. So that's exciting to know. And the other planning for us is it has very excited to. Oop, gone. Can you still hear me, Melissa? Okay, I'll keep going. Very excited to let you know that we have been offering training to Aboriginal, Torres Strait Islander health workers, both in the HHS's Queensland Health and in the community control, so that we actually have as strong as workforce as possible available to assist with the vaccination program. Importantly, the Aboriginal health workers, you know, are really closely, if not all, connected to our community. So that'll be an important role that they're going to play, and we've got all the required approvals for that training to happen and for that workforce to be a part of this exciting time of rolling out the vaccinations. And in terms of comms, I will comment, Jeannette mentioned the information kit. We're going to be pressing go to say HHS to start doing some local communications. We've got a basic information kit that's going to be a guide for the HHSs. We're also working with the community control sector. We did when we started COVID. A lot of you know the Institute for Urban Indigenous Health, IUI, who've got the deadly choices. We're working with them again. We worked with them in the first round of COVID. We also worked with the Punapima Cape York Health Council, or Apanipima Cape York Health Council, whichever way you pronounce that. And we're asking to work with them again, as well as the peak body, which is the Queensland Aboriginal Health Council. So that comms we will be turning our attention to and prioritising, and we'll be using with a high engagement. I've always advocated, and Jeannette alluded to it, any communications materials, resources is available on the Queensland Health website. As always, the authoritative source, the government websites, both Queensland Health, Queensland Government, the Australian Health and Australian Government, they're the sources of truth. That's where you'll find a lot of resources. Our asset library, as Linda knows because she worked with us on it, we make sure that we link to as many of the resources we know available, whether it's government resources or community control. We put up as much as we can in that one place in our asset library. So it's a really good source to go to for communications, but we do encourage the local comms, and we will be encouraging local communications in the vaccination rollout. Lastly, I might, and then the key messages, just to repeat Jeanette's messages, is that this is going to be individual choice. It is not mandatory, and we have to be wanting to communicate that. Jeannette, I talked with the Minister earlier today, and she's very clear that we should be promoting the rollout of the COVID vaccination, whether it's COVID or AstraZeneca, that it's the vaccination, and they're both doing the same job. Even though we've been describing it in 1A and 1B, we're encouraging a rollout of the COVID vaccination. And I think that'll be one of the messages we'll be promoting. And it's really important that we try and get this clear, timely, accurate information so people can make informed choices about what they want to do. And, you know, like, I don't know whether you said it, Jeannette, but we do, and like anything else that's new, we get early adopters, and we'll be encouraging that. And, you know, then we have to give people time. Certainly, there may be questions about our communities, particularly the discrete. Jeannette talked about the 6 hubs. When we do go to the discrete communities, we're likely to be vaccinating the community. We won't be doing the age differential, and that's, I mean, that's all the adults, all the First Nation adults, 18 and above. We will be wanting to vaccinate the community. And similarly, I think probably in small rural towns and others where it makes a lot of sense that that's the best practical way to do it. I just wanted to give you a quick opportunity to say, Jeannette talked about the success here, and that was the leadership in terms of, you know, we effectively protected First Nations, and we're really proud of what we've achieved both in Queensland and across the country so far. We've only had 11 cases in Queensland. None of those are active at the moment. We've had 6 deaths in Queensland, but none of them are First Nations people. We've had something like over 46,000 testing regime, and Jeannette always keeps us accountable to maintain that testing rates, which is really important, and we continue to do so. Nationally, there's only been 150 cases nationally of First Nations. So for the first time ever, we're one of the lowest percentages of a rate, and that's 0.5% of all cases in Australia. And proudly, we're only 11 in Queensland. So we've done a really good job here. I think I'll end on that. And because they're really keen to hear from you guys, what you've got to say. And I wish I could see some of you.
I know.
I can only see a few faces.
I know, it's disconcerting.
Oh, I can see I've got family on. I see some of the names popping up.
If you switch to, is it speaker view or gallery view, play with the different views, Haylene, and
Maybe it was my fault.
Oh, Jeannette.
I don't know.
Gallery view. We'll try.
Gallery view. Where do we go?
We're all still learning this technology. At least we're not mute.
Yes, at least we're not mute. I thought it went off there for a moment. But we're keen to hear from you in terms of what your questions are.
Yep. Excellent. Thanks, Haylene, and thanks, Dr. Young. So we have been furiously collating all of the questions from the chat, and we've got some here ready to go. So the first one is from, I believe, a group of elders in Mount Isa in the Hospital and Health Service boardroom. Thank you so much for joining us. There's a question from them to you, Dr. Young, around simply how does the vaccine work? What, you are on mute.
Unmute.
There we go.
Can you hear us?
Yeah.
We can hear you now.
It's not a medication. So a medication would stop you if you got sick would help you recover. It's not a medication. It's got to be given before you get infected. So then it boosts your immune system so that you will respond to the virus much, much more quickly. So therefore, you won't get as sick, and it protects you from severe illness and from death. So that's how it works. Vaccines are different. Some vaccines stop you getting infected at all, but other vaccines stop you getting particularly sick, and that's this one. We may, when we get more information from what's happening in the UK, find that it actually stops a lot of mild disease as well, so stops you getting infected, but we don't have that information at this stage. We know it stops you getting sick and getting severe disease, but we don't know whether or not it will stop you getting infected at this time.
Thanks, Jeannette. And I did mean to say we won't get to all of the questions tonight, but we will do our best. We are planning to hold another Q&A in a couple of weeks during an afternoon, so more people can attend. So that will be another opportunity to ask your questions. We will pass on the questions in the chat to both Dr. Young and Haylene. I think they'll be really useful for them and their teams afterwards. And we'll also pop a number in the chat. If you have any questions, you can call 13 Health. we'll put the line in there. They, through some special COVID funding, have employed Aboriginal and Torres Strait Islander nurses, and you can ask to speak to them to ask your questions if they're not answered tonight. So quickly moving on, Rachel, would you please ask your question about criteria for 1B? If you can just take yourself off mute. You with us, Rachel? People might be dropping in and out with the weather. Rachel, are you there? No, okay. I'll ask Rachel's question. So this was people who meet the criteria of phase 1B. How are these people advised and notified?
Right. At the moment, we're working. We're working through to get all those lists of people. We won't be starting 1B for another 4 to 6 weeks, so we'll be going through it. But essentially, we'll be making sure the community knows that we're moving to 1B, and people know themselves. If for First Nations people, they're over age 55, so they'll then be able to go to their usual provider. As we heard from Haylene, all Aboriginal healthcare services have agreed to roll out the vaccine except for 2. So for those 2, if people usually go to those 2 practices, there'll be an arrangement with the hospital and health service, so they'll be able to get vaccinated there. So essentially, when 1B starts, all of those practices will have vaccine, and they'll know their own people who are in that very vulnerable. So the younger people who have severe chronic disease and therefore are captured under 1B, and then other people will know their age, so they'll be able to come forward. But we're hopefully we're trying to get lists so we can also contact people and not just leave it up to people themselves to know.
Thanks, Dr. Young. Now I'd like to head to, I think it's John Ranking. John, would you mind coming on the line and asking us your question on behalf of the elders in the room and their concerns about people with chronic disease? Are you able to jump off mute?
Thanks, Melissa. It's Christine Mann here from Northwest HHS, and we've got a room full of elders, mostly elders and staff. So thanks for, I guess, a number of people in the room, Kerry, if I've reflected this right, and everybody else, is that there's a number of people in the room who have chronic diseases. They are on chronic disease medication, and they really do want to know how does, they'd like to hear from Dr. Young around how does this medication, this vaccine interact with their chronic disease medication. They're highly concerned that perhaps, you know, they get the vaccine and 4 months down the track, they become ill and worst case scenario, die. So if Dr. Young could talk to that point, please.
A lot of people have in communities got chronic diseases and memoirs.
Yeah.
Right.
And Dr. Young, would you mind coming a bit closer? It's a bit hard to see you.
We'll swap because you get.
All right.
Social distancing.
Yeah.
Well, it's not that we've got a desk. It's not a very good room set up, really. Okay, that was a really, really, really sensible question. Thank you so much for asking it. I should have addressed it in my introduction. Brilliant question. So people with severe chronic disease are the people who should get vaccinated more so than other people, because this will protect you from getting COVID, and you'll do far worse if you get COVID. It will not interact with those medications. So people who have chronic disease or any underlying health conditions should talk to their own doctor about it to be reassured. Rather than me go through each of the different diseases, there is information available about all the different diseases and how it may or may not interact with the vaccine. There are no issues there, but I can understand why people might be concerned. So the best people to talk to, the best person to talk to is the person you talk to about the management of your health condition, because they know you. They know your issues. They know what diseases you have, how it could interact. So that's the person you should talk to. So you shouldn't be going to a mass vaccination clinic, not that we intend having many of those. You should be going and seeing your own normal healthcare provider, and they'll be able to talk you through it all. But people with underlying health conditions, it's actually most important that you get the vaccine. That's really important.
Thanks, Dr. Young. And Christine, would you mind asking your other question as well about who can go out to the community to explain this information?
Yep. So one of the elders asked a question: who is going to, like, they haven't heard much out in community at the moment. They wanted to know who is out there talking to the people and community about it. I guess there's been a bit of misunderstanding around, for example, can HHS staff go out and do this messaging? We're of the belief that they can't. So we did say that we are planning. We've got our Dr. Stephen Donoghue is planning a visit up here in the Northwest in a couple of weeks' time. But who else can be out there sharing this information? So I'm not sure if that's a Haylene question about comms and local comms versus state comms. Did I capture that correctly? Who in the community?
Yeah, Christine.
Yeah.
I think I sort of summarised it in my opening statement. Absolutely, we're sending out, with Jeanette's permission, I'm sending out a message across all the HHSs to say, let's start the comms, because the call out from HHS is to start the comms at the same time as we're starting the rollout of the vaccination, and that's important. And we will be saying, go, and here's where you can get resources, and tell us what else you need to assist you with that communications. We'll be sending that out this week or early next week, as soon as we can, and I'll make sure that Jeanette checks what we're sending out. Secondly, I will say, you know, we will be working with the HHS, with the community control, in making all those comms happen at the local level, and I'm ensuring that people understand that this is not mandatory, that it is voluntary and it is individual choice. We have to keep saying that, but we will be sending out the messages soon. And a couple of the public health officers in the HHS have asked that same question.
Thank you.
But remember, for an individual who's got concerns about themselves as an individual, the most important person to speak to is the person who normally gives them their vaccines, because they know them. So for those people, for everyone else, yes, there'll be more generic comms that will go out into every community. And again, it'll be delivered by the people you're used to seeing. So that is your staff in your HHS or in your Aboriginal controlled health care service. It's those people, and they'll be given, as Haylene said, all of the material that will assist them to be able to go out and talk to people. But you've got to talk. This is a vaccine. It's important that you get that information from the people you would normally get information from.
And we did, I might take an opportunity just to give the Director General a plug, because he organised a statewide workshop that we held yesterday and Health Consumers Queensland were integrally involved, and we had a huge room of all, you know, PHNs, community control sector, HHSs, both at the leadership position and the public health vaccination leads, and that workshop was held yesterday, and that's where they brought the comms issue, raised it with us at the workshop, and it was a very successful one in terms of engagement.
Comms is short for communications. Sorry, I just saw on the chat come up. Sorry about that. Communication.
Could we talk a little bit more about the communication? There are a few questions in the chat about that. Perhaps could I hand over to you, Auntie Karen from Mornington Island Health Council, to ask your question?
Yeah, sorry, having difficulties removing the mute thing. Anyway.
Yeah, hi. Hi guys. My question is around what resources you have that we can use to explain to people in the community, our guys in the community.
Sorry, I keep on getting muted.
Melissa.
Right.
Not me.
So there is communication information on our website and on the Commonwealth website, and that's available to everyone. And we're also sending out specific information, which is from those sites. It's not different information to different communities to be able to access it. So it's all there. Have we checked if it's got loaded yet?
It's not loaded yet.
It's not yet been loaded on our website, but it will be very shortly. So you'll be able to get it directly from the website, but we're also sending out information across the state to different groups.
And what the kit essentially has is a whole heap of key messages, the way that you might have those messages for different audiences. We'll have relevant links that you can go to. We'll have some posters that you can use but apply locally. So it'll be a package of information. I think they're trying to coincide it, putting it on the web with the email broadcast that I'm going to be putting out to the HHSs.
And we can make sure that we circulate that too.
Coloured, isn't that?
Say that again, sorry, Arnie.
Sorry. You know, some of our mob like coloured pictures and that to explain it to them. And so far there's nothing on the website that I can see.
Yes, so that it hasn't been loaded yet, but it will be soon. And yes, it will be fairly easy, I think, to see and understand. Yeah, so it's been developed with Haylene's group, who understands how to try and explain things.
Yeah, we're trying to make sure that we have a mixture of available posters, Auntie, but as well as that the local HHSs or the community control can work with local people to make sure those messages are, you know, presented in the way that they know the best to do that.
Yeah.
Yeah. And the street communities, so I might just take the opportunity, we will, you know, it's one of the opportunities we have is with the Aboriginal Torres Strait Street community. It's actually a lot easier for us to actually engage because we can go directly to the councils and directly to the HHS and the community control organisations there because they're a nice, you know, community group. So it's actually easy for us to engage with comms and other things.
Yeah, it doesn't, sorry, the information is okay.
Yep.
But we will break it down in a way that our guys understand.
Get vaccinated, it's free, you have a choice. It'll be the way to protect your community. We'll have pretty simple messages.
Come on, Haylene, you know I'm reading.
Oh, Karen, it's Karen, how are you?
I'm thinking of if I should get it.
Yes, you should.
Yeah. So that, I want to know all of that.
Yeah. Yeah, absolutely.
So we will, as I said, we'll make sure that we send all the, and sorry if we do keep muting you, I'm really sorry, Dr. Young and Haylene, because it does cause an echo. We will send through all of the chat to you. There are lots of comments in there, people asking about if there's any type of conditions that should flag extra caution for the ageing health consumer who is considering having the vaccine, if it's recommended for over 65s currently on chemo, if you have asthma, if you have an allergy to eggs, what priority group pregnant women will be in, people on dialysis or transplant, chemo or post-chemo, immunosuppression. What we've heard you say, Dr. Young, is if you do have concerns individually for yourself around those conditions, speak to your GP or your healthcare provider or your specialist. That's correct. But it will be important for that information to be in the communications that Haylene is talking about are coming out soon.
Yeah. So a few things there. At this stage, we're recommending that women who are pregnant or planning to get pregnant should speak to their treating healthcare professional because it's really a risk assessment at this point in time. There are some pregnant women we think no matter what should get vaccinated, for instance, with severe underlying disease, they've had a transplant, things like that. But for others, we think you should wait a little bit longer till we get some more data. So far, the data in the UK where they have vaccinated women who then got pregnant, so they didn't intentionally vaccinate them, the women then managed to get pregnant and so forth, they've not found any adverse consequence for the mother or the baby. There's been no increased risk of miscarriage, etc. But we just want to wait for a little bit more information. So at this stage, we wouldn't recommend that pregnant women or women planning to get pregnant be in the earlier phases. Just wait till later, delay it a little bit. Now, women who are breastfeeding, that is fine. So initially there was some advice that perhaps they wait. Now the advice is they've looked at that because there are a lot more women breastfeeding than there are pregnant. So they've looked at that and there is no risk to the baby or to the mother at all. So breastfeeding mums should get vaccinated as soon as they come up in the schedule. But pregnant women or women trying to get pregnant, just wait for a little bit longer unless you've got really severe underlying health problems. So that's one to talk to your own doctor about. So there's then another group we're saying don't get vaccinated are those who have anaphylactic reactions, you know, severe anaphylactic reactions. So carry an EpiPen with them everywhere they go, you know, really have severe reactions. We're saying to them, you need to speak to your treating doctor about it before you get vaccinated. So it doesn't mean don't get vaccinated. It just means you've got to get specific advice because you might have to be vaccinated somewhere where you can be watched very carefully. So they're really only the absolute contraindications at this stage. Everyone, and as I say, that could well change. I'm sure that we'll find they'll be perfectly safe to vaccinate pregnant women. It's just that so far the trial hasn't been done, which is why, although in theory we cannot see any risk to it, because this is not live virus. You're not being vaccinated as you are with some vaccines with live virus. So you can't get the disease from the vaccine. And you can't spread the disease from the vaccine, unlike some other vaccines. So there is no theoretical risk why this would be harmful to a pregnant woman, but the trials have not been done, which is why at this point in time, TGA is not recommending it to everyone unless you've got severe underlying disease. And then the other one was if you have anaphylactic reactions, so severe reactions to vaccines or to food or to other things. So it's really, really severe allergies. Otherwise, it is safe for everyone else.
Thanks, Dr. Young. We'll have one final question, which is about flu. Can I go to you, Joy Savage?
Sure. Thanks, Dr. Young and Haylene. I guess in terms of the communications to many of our communities, as you said, our childhood immunisation, we have really strong and high rates. Adult immunisation, however, isn't as impressive, but many community members are aware of, flu vax and pneumovax. Just in terms of the overall approach to COVID-19 and vaccination, what's the similarities in the approaches? So that might actually provide some familiarity in the conversations we have, particularly with the adult population in and around the rollout. Thank you.
Sorry, I lost my mouse to unmute. Right. Really, really, really good question. And one thing I forgot to tell people is at this stage, you need to have 2 weeks between the COVID vaccine and the flu vaccine. And that doesn't matter whether it's the first COVID vaccine or your second COVID vaccine or when the flu vaccine, you've got to have 2 weeks between any of them. So that's important. Now, I think at this stage, it's more important to have the COVID vaccine and then have your flu vaccine. So delay having the flu vaccine rather than delay having the COVID vaccine, if that makes sense. But if you're offered the flu vaccine and you know you're not till phase 2A, which won't be till about May, you could have your flu vaccine first and then follow it with the COVID vaccine. I hope I haven't thoroughly confused everyone. It's just 2 weeks between those 3 vaccines is important. Now, in terms of a comparison with the flu vaccine, the first thing is this vaccine is much, much, much more effective than most flu vaccines. So flu vaccines vary year by year in terms of how effective they are. It depends how well matched they are to the strain that's circulating that year. And often we're a bit behind in our catch up with the flu vaccine. So the flu vaccine gets reformulated each year, depending on what the strain has been that's been circulating in the alternative hemisphere. So we base our flu vaccine each year on what's been circulating in the Northern Hemisphere in their previous flu season, which is 6 months behind ours, of course. And sometimes we get that wrong and we generate the new strain. So the vaccine doesn't match. So whereas for this, our COVID vaccine is far more effective because it's matching the variants that have been circulating. It won't necessarily match some of the newer variants, but they're not the predominant ones. So at the moment, our COVID vaccine is much, much more effective than the flu vaccine. Now, in terms of the way it's stored, the AstraZeneca is stored in a very similar way to the way the flu vaccine is. So 2 to 8 degrees Celsius in a vaccine fridge. It is totally different. The Pfizer vaccine is totally different to the flu vaccine. It's stored at -70 degrees Celsius in a freezer. So that's very different. But AstraZeneca, which is why I said earlier on, it's when AstraZeneca gets rolled out that we'll be able to roll it out to anywhere in the state that normally has flu vaccine and normally provides that. So it'll be very similar to that. So I hope that answers those queries about the flu vaccine and the comparison.
Thanks, Dr. Young. That's great. So now I'd like to end by handing over to John Anderson, a consumer from our network, for his reflections from a consumer perspective on this evening. John, could you introduce yourself and then share your thoughts? Okay.
Thank you, Melissa, and Watamuli, everybody. I pay my respects to elders and to all that country where each of us are taking this conversation from. I pay my respects to all my old people on this day, which would have been my sister's 62nd birthday. Pay respects to my elders, the eldest there, Auntie Alvina Munn out there in Mount Isa. She's 93, bless her. A walking library. Bidjara, Karakara, Garingbull, Momo and Nwagi people, and my Bookman family up back there on Palm as well too. First off, I'd like to say that there ought to be some acknowledgement of Queensland health efforts to date. This ought to be recorded for the way in which the many have been kept safe. The few, though, who invariably occupy the fringes of our communities are often socially isolated and subject to health injustices, away from where the light-on services are the dimmest. So this is going to remain a critical challenge for all of us, for all Queenslanders, yeah? I give thanks, and I acknowledge as well there too that Sister Haylene Grogan there was brought on in the right time, proper deadly right time. I agree with you. Jeannette. Comments made during the evening there too about a ready reckoner of vaccine rollout resources, including about the phases. And some of these might be developed by local developers. One of my strongest experiences around road safety was a group of deadly young older women in Alice Springs, English as a third language, but they developed a road safety message using a talking VB can in local lingo. So please, let's not stay fixed on developing these comms resources in southeast Queensland. Give up some of this, some of these roles to it being developed in the Torres Strait, in the Gulf and elsewhere, where language and those relationship networks are still strong and extremely important to be fed and harnessed. I acknowledge there too one comment there about that clash with industrial relations. So some of that challenges around staff refusing to be vaccinated. That's a conversation that ought to and has to be heard. Also, the need to be reaching the demographically diverse First Nation consumers, aged, those with different abilities and the like, mental health concerns and so on. We have to reach our diverse community wherever they are. So that comms engagement and planning is extremely important. Back to some further comments also from First Nations consumers. The angst of the aged. This is real. It transcends experiences that few of us will never have. So when you talk about older people that have experiences from the time of the Spanish flu and decisions that were made there and then, and yet we're lining up again and going through those same experiences that we had, lining up for flu vaccinations, lining up at the dormitory for food and tucker, and so on. So the mental anguish that comes from these experiences of another lining up, and this time it's for the COVID vaccine. Finally, there's some relief of us mob being a minority. Only 0.5% of us across Australia with COVID. It's one of the first experiences that I've had where it's great to be part of a minority, hey? The service gap that we've experienced and seen in the early days of COVID, and one of those gaps experienced intimately is the gap between Mumu Health Service in North Queensland and TARS. For some reason, they couldn't get across and share services across that Cardwell range. So we have to think, be mindful of those gaps in services, the service overlaps and the like out there. Please use First Nations relationship networks, because those ancient trading networks, those ancient ways that we share comms around this magnificent Queensland landscape are there, they're tangible, and they ought to be fed, honoured and respected. Thank you, Haylene and Jeannette, for your time, for keeping us safe. But please, let's continue these conversations and face these challenges together. Yeah. Thank you, Melissa.
Thank you, John. Thank you so much, as always, for your amazing and rich wisdoms. Haylene and Jeannette, could I pass over to you for any final comments, and then I'll wrap up?
No, you go.
Thanks. I'll put my hand up because I did want to. Thanks, John. I appreciate that beautiful summary, particularly, making the connect to the past for our mob. And certainly there is, we are working. It's exciting times for us with our health equity agenda, where we're now going to be, and we should have been, working closer with the community control sector, no more them and us. It's how we're going to collaborate and have better integration of services for our mob. And certainly COVID has tested us in that space, and that's a really exciting time. I did want to give a big shout out for my family online. I can see a few of them there, and thank them for joining us. I think some family already left, and also for all the mob that I know, particularly the health workers that have been around for a long time. It's nice to see you all, and I'm really privileged to be back. I know many of you know I've been away 10 years and come back, but I grew up in Queensland Health, so it's exciting to be back and to be a part of this journey again, and to be in a state where we're getting it right and really going to hopefully kick goals for 2021. And we have to get it right in the vaccination of COVID. COVID vaccination rollout. It's really important. And thanks for that, John. You always talk beautifully.
Thank you.
Just thank you. Thank you very, very much for organising this session, Melissa, really and truly, and very happy to come back anytime. You're just a fantastic group, and I do not underestimate what you've achieved. I hope that someone writes it up. I really do, because we should share it with the world, what you've achieved with COVID. So thank you to all of you.
We are in the best place in the world too, by the way.
It is a great place. Yep.
Absolutely. Well, thank you, Haylene, and thank you, Dr. Young, for everything that you've done to keep us safe, for always being so open with everything that you know, explaining it in simple ways for us to understand. And we will definitely hold you to another conversation and invite everyone along again. Thank you to everyone for sharing your